And before we go any further, just wanted to acknowledge that Burnaby Hospital is situated on the traditional, ancestral, and unceded territories of the Tsleil-Waututh, Squamish, and Musqueam nations. We would also like to honor and recognize the North Fraser Métis chartered community, as well as the many diverse First Nations and Inuit families who call this territory home. So again, welcome. Our hospital is embarking on a journey of transformation and significant growth. And it's a really exciting time for just given our hospital's history when we first opened our hospital doors in 1952. And you can maybe see some of the 1952 building in my background. The patient-centered design will improve the experiences for you, our patients, and families for many years to come, and providing space that meets contemporary standards, increases privacy, and promotes healing. So I'd like to introduce our team members who are here this evening to take part in this community open house. Noor Esmail, our Chief Project Officer and Executive Director for the Burnaby Hospital Redevelopment. Maybe give a wave, Noor. Thank you. Dr. Sarah Osler, our Site Medical Director at Burnaby Hospital, as well as Dr. Brian McGowan, our Physician Lead for Burnaby Hospital Redevelopment Team. Mandeep Edmonds, our Deputy Chief Project Officer for the Hospital Redevelopment. Anita Vempe, our Clinical Director for our redevelopment project. And Danielle Steelman, our Director of Development for the Burnaby Hospital Foundation. Thank you so much for all joining us this evening, and I'll now turn it over to Noor.
Well, thank you so much, Leanne. It's so exciting to be here. And I'd just like to introduce myself again. I'm Noor. I'm the Chief Project Officer and Executive Director for the Burnaby Hospital Redevelopment Project. Thank you so much for joining us this evening. Our agenda will be to provide you a project overview, a construction look ahead. We're going to share some updates about our Burnaby Hospital Foundation, how you can stay informed, and for the latter half of the session, we're going to undertake a Q&A session, and you can log into slido.com to provide any questions using the code #COP-BHRP. As a project overview, the Burnaby Hospital Redevelopment Project will transform the hospital into a modernized medical and surgical healthcare campus. Our phase 1 will include the new Keith and Betty Beavy Pavilion, an expansion of our support facilities building to include a new energy center, and renovations to the existing buildings on the healthcare campus. Our design and construction for our phase 1 is already underway. The project was awarded to Ellis Dawn in June to undertake the phase 1. The new Beatty Pavilion and expanded support facilities building are expected to be completed in about 2025, with our renovations to be completed around 2027. Our phase 2 will increase the hospital's bed capacity and expand our cancer services. The planning is in progress right now, and currently we're working on a business plan or a business case, which will be submitted to the provincial government for approval in June 2022. It's expected that construction for the phase 2 will start late in 2025. Our presentation this evening will focus on phase 1. In phase 1, we'll have primarily single patient rooms with private bathrooms. We'll have a co-located maternity and newborn care unit to promote family-centered care. We'll have a new mental health and substance unit, with access to an outdoor space to enhance healing. We'll have medical inpatient unit with negative pressure rooms to enhance infection control. We'll be expanding our operating and procedure rooms, increasing the number of surgeries that can be performed. We'll have expanded emergency department, reducing wait times for all of our patients and families. And we'll have additional parking for improved accessibility. What you're seeing now is a bird's eye view of the hospital. I'm sure you can recognize the parking lots. There's one at the southwest corner and one you can see at the southeast corner. Our phase one will wrap around the eastern and southern faces of our existing support facilities. It's shown here in the light green, and you can see the nursing tower in the northwest of the site. Our phase two will come after the demolition of our Cascade and existing west wing. You can see the footprint just below that on the left-hand side. That's still to be determined around the phase two, but we know about our phase one, which is proceeding as shown here on this bird's eye view. So our construction look ahead for phase one. This month, we've already started the Cascade demolition. It's in a soft demolition, and I'll speak more about each of these components in subsequent slides. In November to December, we'll be undertaking continuing with the Cascade demolition, and this will be more structural demolition. We'll be undertaking a storm line work along Kincaid Street. There'll be a relocation of our bus stop that's on Kincaid Street right now. And of course, we'll have to undertake some tree removal for the construction to occur. In January 2022, our excavation will begin for the main construction. And by February, we hope to have completed the Cascade demolitions. The details and timelines for all of these components are still being fine-tuned, and we'll keep you posted on the impacts as we learn more. So what you're seeing here is again a bird's eye view. It's probably a satellite view now. And what I'd like just to highlight is that you can see at the top left of the image, there's the Cascade demolition. That's the Cascade building that underwent an unfortunate event in November 2020. That has to come down. The first stage of the Cascade demolition will be soft demolition, which involves removing and stripping the interior of the building. The structural demolition will begin in mid-November. The building will come down in a controlled manner to minimize noise, dust, and disruption for patients, staff, and of course our neighbors. The demolition is expected to be completed in February, as I said, and once complete, it'll make room for phase one redevelopment activity and the proposed future phase two patient tower and cancer center. At the bottom right hand, you can see a storm line indication. There's a red line there. So road work along Kincaid Street to install a new storm line pipe will begin in November. The Burnaby Hospital Redevelopment Project is doing this work in partnership with the City of Burnaby in order to modernize the storm line system to separate the pipes from stormwater and sewage. Currently, there's one pipe, and we need to separate this to make sure that we have the right systems in place. Of course, a traffic management plan will be in place to minimize disruption to residents, businesses, and hospital staff, patients, and visitors. We'll also be undertaking a bus stop relocation. Currently, the bus stop sits right in front of the support facilities building along Kincaid, and we'll have to move this towards the Kincaid-Ingleton area just so that our construction activity does not impact the bus route. And as I mentioned earlier, there's some trees located. You can see them just behind the bus stop sign. Thank you, Wendy, for pointing those out. Unfortunately, we we have to remove some of these trees. I know trees mean a lot to people and to our planet, but the hard truth is, with limited space to expand on the site, these trees will need to be removed to make space for the new BD Pavilion and the expanded support facilities building. We will, of course, adhere to all the bylaw requirements and are waiting for our tree permit approvals to share more details about the impact of the trees on our campus. We'll be working with the landscape architect and community partners to discuss ideas and opportunity to repurpose some of these trees. And at the end of the redevelopment, there will be new green spaces for everyone to enjoy, to rest and respite in. We are committed to share regular and timely notifications of construction schedules and impacts with our neighbors. We encourage you to subscribe to the construction notices to stay informed, and there's a website provided. It's at fraser.ca-bh redevelopment. We also can be reached at the email provided, bhredevelopment@fraserhealth.ca. We look forward to hearing from you, and I'd like to now pass it on to Danielle from our foundation to share about the campaign to support redevelopment.
Perfect. Thanks so much, Nora, and welcome everyone who's able to join us this evening. As Leanne briefly mentioned at the beginning of our presentation, I am Danielle Sleeman, and I'm the Director of Development at Burnaby Hospital Foundation. And really here within the hospital and the community, Burnaby Hospital is really a community serving a community. We have many different people coming and going from our building every single day, and our family of nurses and doctors and healthcare professionals take really great pride in their spirit of innovation and dedicated service to be able to serve you and your families when you need healthcare. And so they are challenged in their ability to provide some of these services sometimes as they are performing healthcare in a hospital that was built in 1952 and hasn't been really expanded since 78. And, you know, Nor touched on some of these challenges that they are experiencing, and it really requires some much needed attention. And to help really paint the picture, I should add that Burnaby is the third largest city in our province, and our population has increased by 75% since the 70s when the hospital was last redeveloped. And what our hospital now serves over 500,000 people a year. And so they're coming from all over Burnaby, but we also have regional services as well. So people are coming from East Vancouver and beyond to receive some of this healthcare here. So we really do need a space that can accommodate everyone in our community. Wendy, if you want to advance the slide, that would be fantastic. So that kind of brings us to why we're here today. And we know that Burnaby has a very proud history. In fact, the community came together more than 70 years ago to help build this hospital. And now we're looking to the community again to provide some support so that we can transform our campus of care. And this kind of brings us to what the foundation does. So we are the fundraising organization of the hospital, which helps bridge the gap between what the government provides in terms of funding and what our community needs. And so we know that we need a new hospital. And that brought us to launch our Proud History, Bright Future campaign, which we launched about 2 years ago now. And we are currently raising $30 million to support this transformation of phase one, which Nor has just gone over for you. I'm excited to let you know that we have raised $21.5 million towards this goal, and we are focusing on services that are critically important to all families, and that includes emergency, surgery, maternity, mental health, and medicine. And all of the donations that we receive from our community is going towards the purchase of medical equipment to provide state-of-the-art technology to help our dedicated caregivers to provide the best care that they possibly can to you and your family and the rest of our community. We'll just go one more slide, Wendy. Thank you. So if you want to know more about how you can get involved in helping to create a brighter future for healthcare in our community, please don't hesitate to reach out to myself, Danielle. My contact information is listed there, as well as Christy James, who is our CEO. And we're also, all of our campaign material is located on our website at bhfoundation.ca. So don't hesitate to reach out. If you have any questions at all from the fundraising side, we're here to help and answer anything that we can. Thank you.
Thank you so much, Danielle. That brings us to our Q&A part of the evening. And I think thank you, Wendy, for joining us. You'll help moderate the questions, please.
Correct. So I'll just give folks on the line a chance. If you just want to pull up your browser, type in slido.com. You will be prompted to punch in this code COP-BHRP. So once you're in there, you can feel free to type in your questions, and I'll just be switching our screens over here.
While we're doing this, just want to recognize the amazing work the foundation has done and how the community has stepped up. Over $20 million already raised. That's incredible.
All right. So we've got a couple questions there, so we'll go ahead. First question here is, will the washrooms in the new hospital be accessible? I have a sister with complex needs and uses a wheelchair. Will there be adult change tables and lifts? Anita, would you like to take that one, please?
Okay, I think we're having technical difficulties. So
can you hear me now? Sorry.
Yes, we can hear you.
Sorry.
Yeah.
That double mute always gets you. So thank you for the question. Yes, we are going to be having accessible washrooms throughout the entire site. We are looking at adult change tables for phase 1. It is not part of our plans yet, but we recognize that it was lacking. And so we are looking at this throughout our planning to see if this can be added. For phase 2, it is included in our clinical service plan and will be going forward in our business plan for that. So for sure for phase 2, and we are looking to include it for phase 1.
Great, thank you. We'll move on to the next question. How much is this year's provincial budget allocated to Burnaby Hospital rebuilding project? Noor, would you like to answer that one there?
Right. I couldn't actually say by the fiscal year how much is going to be allocated to the project. I don't have the cash flow information handy with me, but I can tell you that the project was approved by government for phase 1 just over 600 million, $612 million, and phase 2 has been approved by government at $811 million.
Great, thanks, Noor. Next question is, really looking forward to that new hospital. I can see the hospital from my home. How will you manage noise and construction impacts to the neighborhood?
Right, that's a great question. We always, progress is amazing, but it comes with some early bumps along the way. And of course, noise and sometimes if you're close, dust can be an issue. We will adhere to all the bylaws. The working will be limited during the times that we are actually allowed to undertake work, which won't happen early in the morning, evenings, and weekends. We will make sure that any heavy equipment or construction vehicles will be doused with water so that the dust impact is limited. But to the extent that construction creates those kind of impacts, we'll do everything we can to limit them.
Thank you. And as Nora mentioned earlier, we do encourage our neighbors to subscribe for construction notices so we can let you know timely information, because things are going to be changing rapidly and we want to make sure you guys get the most up-to-date information in your inboxes. And you could subscribe to our website through our website, fraserhealth.ca /BH Redevelopment. And I'll put up that screen at the end of our presentation again. Next question is, will the new hospital be better prepared for a pandemic? Anita, would you like to answer that one?
I can. Can you hear me okay? You're breaking up a bit.
Yeah, no, we're getting a bit of an echo, so it seems we all need to go on mute. That's not speaking, please.
Okay. Thank you. So, yeah, there's the number of additions that we are including to make sure that the hospital is better prepared for not just a pandemic, but for all infection control prevention. So, in the emergency room, we're going to be including better air pressured room to help with infection control. And we are actually having a brand new medical unit being built, which can be divided into 2 separate areas for outbreak control. So if there is an outbreak on part of that unit, we can close that unit and have that be a separate unit from the other unit. So a lot of great work there to help prevent any spread of infection, as well as the whole hospital as a site will have more areas for hand washing, the standard areas between patients and private rooms.
Great, thank you. Just a reminder, folks, again, we'll be taking questions only through Slido. So if you want to just hop onto slido.com, that's the easiest way we can manage all the questions. Thank you. So next question here is, will there be more parking? What about e-chargers? Nor, would you like that question?
Yeah, absolutely. Parking is a necessity, and we will be adding additional parking as part of phase 1. I think there's over 88 spots that will be increasing, and there will be e-charging both for vehicles as well as for bikes. For phase 2, we haven't gotten to the parking details yet. That's part of the planning that we're still undertaking.
Thank you. The next question is, how will the new hospital incorporate Indigenous culture and recognition of the traditional lands? Anita, would you like to take that question there?
I can start this for sure, and if anyone wants to join in. So we are actually working in partnership with our Indigenous groups in the community. We have met with them already to incorporate their ideas and thoughts into the new build, and we'll be meeting with them more further into the future when we get into interior design, working closely with them to include aspects of their heritage into our building. Does anyone want to add anything to that?
Yeah, it's Leanne. I just wanted to say this is such an important piece of work, and we have an established working group with our Indigenous community members, and there's a tremendous amount of learning, and we just look forward to continuously working together on this moving forward for both phase 1 and phase 2.
Thank you. Okay. The next question is, how will people with mobility aids, walkers, wheelchairs, be able to access the hospital during the construction?
I can add that there be proper access allocated throughout the construction. We're working with our construction teams to ensure that we'll maintain the same level of access there currently is right now. Not getting into specifics of entrances, but we will work with them to maintain access.
Great, thank you. How will the new hospital incorporate oh, sorry, I think that's been asked. Let's move on to how many patient room and beds will be added in both phases?
I can start that off. So in phase 1, we actually only have 24 net new beds, but we have about 100 new beds. But because there's cascades and the other wing coming down, they're going to be replaced by brand new single room beds. So there's only going to be 24 new, but about 100 net new altogether. In phase 2, there's going to be about 100 net new beds. So on top of that, there'll be an additional 100 beds to that. And that includes services for phase 1 for mental health, medicine, maternity NICU. And for phase 2, there'll be ICU, intensive care, cardiac care, and more medicine as well.
Great, thank you.
Mm-hmm.
Next question is, how will the traffic plan be communicated to the public? Nor, would you like to?
I was going to say,
Sure.
Wendy, you can answer.
Yeah, you should answer that one, Wendy. Our
For sure.
communication
So,
lead. Yeah.
like, we will be sharing construction notices with neighbors, and so while we alluded earlier that, you know, it's great to be able to subscribe it, so that way we can make sure that those are delivered to your inboxes. We also will be you know, working with, you know, we'll be sharing traffic impacts, you know, if you're coming in through the neighborhoods on our website as well for patients. And if there's any regular patients coming in for treatment, we'll be connecting in with them and the services there to ensure that regular patients coming in will be notified of any traffic impacts. Okay, next question is, who is working on the interior design specifications and both phases still in design build stage?
Yeah, that's a great question. And it gives me the opportunity to actually explain how this is going forward. We're probably used to a normal design and construction contract where design is taken on earlier separately by the owner, and then you tender out and a contractor is engaged. In this case, we actually have what we call a design build. And it's one package that goes to our proponent, in this case Elliston. They'll be undertaking both the design and specifications as well as the construction for us of the new builds. So their team that includes a number of architects and engineers will actually undertake the design for phase 1. Now, phase 2, we're just in the planning stage, which means we're in a business case development stage. And that's being done internally. We've hired a team of architects and engineers to help us with that. It's not the final design in phase 2. It's what we call an indicative design. So I hope that answers the question that how the work progresses. But of course, we'll have input into both the phase 1 and phase 2, input from our stakeholders, our partners, and all of our the teams that engage with us in going forward with the designs.
Thank you. Next question here is, what is going to happen to receiving and shipping?
Yeah, so our loading docks, which are accessible through Elmwood at the rear of the site, will remain. That entrance will remain for phase 1. The location of the loading docks, as we call them, receiving and shipping, will remain where they are. And in phase 2, they will expand. But the expectation is that it'll be in the same general location as they are in right now.
Great, thank you. Next question is, are you going to share detailed plans?
That's a great question. So we do provide our plans through again, because of the way the contract is, it's really not us, it's not Fraser Health or Burnaby Hospital, it's through our partners, Elliston, and they'll be undertaking their submissions to the city for any applications of permits, and the plans will be shared there. We will be sharing perspectives, images, whatever we can in terms of renderings of the facility as they become available and as they're developed as part of our own communication. And hopefully in the near future, you'll be able to see some of this when you come to the hospital so that we can share what it's going to look like in the future. I think one of the images is already being shown today. It was actually a rendering of the elevation as we expect. and maybe when we end, we'll project it so you can see what the expectation is for the new hospital. It's really incredible what we're going to be getting.
Great, thank you, Noor. How much of the green space will you be impacting as a result of this new endeavor? Both for phase 1 and phase 2.
Right. It's actually very little green space existing that'll be impacted. If we just think about the phase 1, as I mentioned earlier, part of it, the Betty and Keith Beatty Pavilion, will actually be on it's where the parkade is or the driveway is right now. So there's no green space there. We'll be building in that location. The expansion of the existing support facilities building will be towards the south where there is a bit of a green space. But our hope is, our expectation, not our hope, but it is our requirement that we'll have new landscaped areas. We'll have all brand new landscaping, areas of respite and rest, and it'll be completely reintegrated into the new site. For phase 2, it's actually no green space being affected. We're building on existing footprint, and we'll be creating more green space, in fact, with the phases as we go forward.
Thank you, Noor. Where can we get details of the design of the hospital? And I think, Noor, you've kind of mentioned already that things will be released and shared, things like renderings and whatnot, and we would make those available on our website.
Absolutely.
Yeah.
We'll also provide updates on the website. Thank you for reminding me. Progress photos, things like that, we'll provide as part of our information to be released with the general public and our neighbors.
Question here is, I assume there will be rooftop handling, air handling, and other mechanical systems outside the completed hospital. How will noise levels from these systems be managed?
There's an engineer amongst us. That's amazing. Okay. So rooftop air handling, mechanical systems. Yes, we will obviously have to have services, infrastructure, air conditioning, heating, air systems. And we're in a really great position that we won't have it at ground level. It'll be at the top of a 6-story building where it will impact very little in terms of noise or any other impacts with our neighbors. Having said that, the equipment is attenuated. These are outdoor units that will, with the noise, will be actually managed, controlled. And we have not only our neighbors, but we have a hospital, and we have to be sure that the noise, especially with inpatient units, are perioperative or surgical areas, don't have any noise or vibration impact. So we have to be very mindful of these kind of things, noise impact. Good question, Therese. Thank you for that. It'll be very well controlled.
Great. Next question is, where is parking going when mental health building is built?
I think we mean the Keith and Betty Beatty Pavilion. Yeah, the parking is going into 3 levels below grade, so we won't be seeing it, but it'll be below ground.
Great. Next question is, how will the additional construction vehicles be accommodated?
There will be traffic, but it'll be well managed. We'll make sure that the route is contained, and there'll be flag bearers to ensure that there's safe movement of traffic. Most of it will occur along Kincaid, where the actual development is happening. And this will be coordinated with the city. It'll be approved by the city, and we'll make sure it does not impact our flows, both of or for vehicles, people, bicycles, so that there's a safe and managed way to undertake the construction.
Great, thanks. How many floors will there be when Cascade demolition is completed? I believe the whole building is coming down.
Sure, yeah, the floors will all come down. If we're talking about the new buildings, we're looking at 5 and 7 stories above ground for the new buildings. For phase 2, that's yet to be determined.
The concept plan of phase 1 was approved in 2017. Why does it take so long to start construction?
That's a great question. In the private sector, we take much less time. Our business plan wasn't approved till 2019, and it's in 2021 that the contract is being awarded and undertaken. I think the way to answer this is that we have to be very careful. This is public projects, public funding, taxpayer funding. We go through a series of steps to ensure that everything we do is very mindful of the limited and competing priorities around public funding. So there's a rigorous process in place by ministry, by government, to ensure that every resource that's spent, whether it's money, people, into government projects, public projects, go through a number of gates to ensure it's the right thing to do at the right time. So it may take a little more time, but we want to be sure about the veracity of our projects.
Great question, thanks. Will there be lifts in the washrooms?
Not sure if those are referring to the public washrooms or the patient washrooms. So yes, the patient washrooms will have ceiling tracks that the lifts will be able to go into. Public washrooms, there is not any lifts planned for them, but we'll always be up to date with the needs and the standards out there for public spaces. So we'll keep an eye on that.
Next question is, do you anticipate any changes to transit access to and from the site after the new hospital is complete?
Yeah, that's another great question. We're working with the city, and the city will let us know what they would like to undertake as part of Kincaid, as well as Ingleton transit routes. For the moment, we're not aware of any changes apart from what I mentioned, the bus stop relocating a short distance away. But we will keep the public informed if you subscribe to our information, or even through our website if there are impacts of transit.
Okay, great. When is the projected end date for phase 1 of the project?
Yeah, so for the new build, the expectation is that that will be completed by 2025, and some of the renovations work will continue until 2027. Of course, it takes time to do all the type of work we need to do and still be a functioning, safe, and fully accessible hospital.
The next question is, will you be protecting the ravine and stream behind the hospital?
Absolutely, absolutely. The riparian zone is not to be touched, and there's nothing on the east side of the site that will be impacted. It has strict both environmental, the Ministry of Environment, as well as the city has guidelines, and we're working closely with them. And it's absolute no-go zones as far as we can undertake. So yes, those will be protected.
Great, thanks. The next question is, I understand the practice of cremation takes place currently on site. Is that correct? And if so, will this practice continue?
I can take that one. We do not have the practice of cremation at the hospital. That is the responsibility of the funeral homes, which they come in to our morgue and take the deceased and then cremate at their facility off-site.
Thank you, Leanne. How is the new beds at the hospital determined? Is it big enough for future growth in the area?
I can comment on that. We determine the number of hospital beds taking into an account a lot of different factors, one being the volumes when we look at population growth. And so we take that into consideration as well as new technologies, new advances. Virtual health has played a lot as well when we determine the number of spaces needed. So our projections are showing that for phase two, we are looking at around 20, 30 to 35 to 40. There's different areas that we look at if we're looking at medical or ICU, but we are planning to project out to that kind of 35 horizon and hopefully beyond in some areas. And as mentioned, the current phase one is not increasing that many, but we will be meeting the needs of our current need when opened.
Great. Thanks, Anita. The next question is, will the new design use reinforced heavy-duty HVAC to better cope with extreme heat? The hottest day of the heat dome felt like a struggle.
Yeah, I know, that's especially last summer when we experienced that incredible heat. You have to remember that at the hospital where we have ACs, some of it is quite old and before climate change. And for the new HVAC, we will be looking at energy modeling and, of course, climate resiliency. It's not always useful to prepare for the worst case scenario, but our new HVAC will be able to take care of the requirements going forward.
Is there any property be considered for easement in the neighborhood?
Yeah, I think the question is asking, are we looking for additional property? I don't believe so. Or there won't be easements associated with anything outside the hospital footprint that I'm aware of. Yeah.
Okay. Using explosives for demo will create small earthquake, which may damage pipes in my own home.
Yeah.
In my home, how do you propose to mitigate this?
Absolutely no explosive. If I wasn't clear before, I apologize. It'll be done in a controlled manner. We'll be doing it old style, not even a wrecking ball. It'll be piece by piece removing. We want to ensure that it's done in a safe manner, least amount of noise, least amount of dust. So we assure you no explosives will be used. Remember, hospital right in there. We have patients there, so it'll be a controlled way.
Thank you. Next question is, will the generator be moved?
Right, yeah, that's part of the plant relocation I mentioned earlier. It's going to be at the rooftop, at the top of the tall building. So yes, those generators will move as well, away from ground floor, no noise issues going forward.
Okay. Has the current pandemic impacted planning? Example, with more admin staff working from home, does this mean a larger floor plan for the clinical departments?
I can take that.
Sure. Go ahead.
Yeah, so our clinical operations team is on site supporting our clinical departments, but I'll let, so there will be no impact to the actual plan in phase one or phase two. But I'll let Nor or Anita comment on the project team right now, where they are working and what we're planning for some offsite space.
Yeah, I can talk to that, and I'm just also the question I think is referring to also how the space impacts the clinical department. So the project team, there is a number of us working from home as well as a few of us still working on site as needed. We will be having a project office shortly moved close to the hospital so that we can do more face-to-face interaction and meeting that we need as we move further along in the design. In respect to the question, I think there was a comment there that said, does staff working from home impact the space of clinical areas? And it doesn't, because the clinical areas are built to the space it needs to be regardless of other staff working from home or not. So there's standards and how big a patient room needs to be, standards in corridors. So that's standard regardless of other staff working from home or not.
Okay, great. I'm just going to move on to the next question. Is there a public consultation on the design and build?
Not sure I understand fully in this form of design build. And public consultation is usually when there's a rezoning requirement, which we don't have. But definitely through any submissions to the city, what the city requires in terms of consultations will be undertaken.
Great, thanks. And any plans will be drawings and updates will be provided as well on our website. What kind of pollutants will be emitted from the new hospital to the neighborhood?
No pollutants that would impact anyone negatively. In fact, even our boilers, when natural gas is used, does not emit any pollutants. So we can assure you that anything that will be undertaken will meet the safest standards and the bylaw requirements.
Thank you. Isn't it inefficient to have a foundation go the effort of fundraising for this instead of just finding it as the public?
I can try and, oh, sorry, Nora, go ahead.
Yeah, I think it's just funding it as the public, I think it might say. So I'll let you answer that, Danielle.
Okay.
Yeah, so obviously there isn't a hospital in BC that is fully funded by a government, and hospitals are very expensive to operate. So our role is to help provide funding for the equipment that will go into the new hospital, once it's built. And so we are focused on funding equipment and not the bricks and mortar of the building. I hope that answers that question.
Great, thanks, Danielle. Will neighbors be notified regarding disruptive work planned during construction? I think we had answered this earlier, that our hope is to be able to share with neighbors construction notices. So again, please do subscribe through our website for that information, and we'll be also sharing it through our social media channels. Which engineering firm? I'm not quite sure.
Yeah, I think the question might be asking which of, like I mentioned, architects and engineers. So okay. There are a number of them, there are quite a few. So they have to be structural, electrical, mechanical, all of them. We can post them on our website. We'll get the list of Ellis Don's partners so that you can see who's involved in the project. They probably have already listed them on their website, so we'll get them.
Okay, great. Given the changing needs of an HC healthcare facility during COVID, are any changes being made to the indicative design to support new ED needs for future adaptability?
Leanne, did you want to speak to that?
I can start and then I'll hand over to Anita. So yes, we've learned a lot through the COVID-19 pandemic, and we are in the fourth wave right now. And so just we will be providing a number of anterooms within the emergency trauma resuscitation room, positive pressure trauma recess room, also the ability for certain zones to be basically in an outbreak situation or outbreak zone. So a lot of work has been done in consulting with our hardworking emergency team of medical staff and staff in this regard. And there'll be further updates and advancements in phase 2, but I'm sure Anita has a few things she can add.
Yeah, you mentioned a lot. That's great, Leanne. Thank you. So yeah, the emergency will have a positive pressure trauma resuscitation room with a negative pressure anteroom. So that's the room between the trauma room and then the public space or the rest of the emergency room. There'll also be, as you mentioned, ability to outbreak, like contain units. So zone 1 and zone 5 in the new build will have the ability to be contained units as negative pressure outbreak zones. There's also other enhancements we're doing. Zone 2 will be divided into separate areas as well, and we'll have better walls and separations throughout the areas. So hand washing sinks everywhere and alcohol sanitizer everywhere as well.
Great, thanks, Anita. Next question is, will you be using alternative energy sources to meet the energy needs? This might be a good example for others.
Yeah, alternative energy such as solar, wind, other modes are out there. They're still quite expensive for the return on investment. Right now, we are looking at traditional, but of course, there's future consideration, and we'll be looking at it going forward as well.
Great, thanks. During construction, if there is any damage on neighborhood homes, who can we reach out?
Absolutely. So one of the things that we can undertake, if you do reach out to us at the email or through subscribing, we can do a photographic survey of the homes right adjacent to the hospital to ensure that if anything does happen, uh, because we know that we will be doing construction. So any concerns you might have, let us know, and we'll come and survey prior to construction start.
Yes, and there will also be, and we'll be sharing this with in more detailed construction notices, there will be a 24-hour sort of number provided by Elliston and their contractors. So if anything emergency were to happen, even in the late evening, there is a contact number that will be available.
Absolutely.
We just got a couple more questions here, and we'll wrap it up. Natural gas does emit CO2. How do you plan to be net zero?
I think we missed one, but I'll answer this one first, and then the one above is.
As a compliment.
No,
Yes.
oh,
there was
sorry.
I see that. Yep.
Yeah, sorry. Just the natural gas. We won't be at net zero. We plan to be towards net zero. Government mandate isn't yet net zero. We will be going towards that. We're already looking at being fully electric in the future. So that could be a direction we'll undertake. Phase 1 does have natural gas, but in the future with phase 2, it could be converted to all electric.
Great, thanks. Is there flexibility in the design for future expansion?
Yeah, absolutely. That always happens. We have to be mindful of the future and how we actually can grow and don't become landlocked. So that's part of what we're doing with phase 2 to ensure that there is growth potential.
I can also add for inside the building, the clinical areas, we're trying to make our areas as flexible as possible. So if we need to change services within, if we need more cardiac beds, we're building in the IMIT infrastructure for future flexibility there as well.
Great, thanks. And lastly, thank you for hosting this session. I believe these sessions will help ease the concerns of those living in the neighborhood. Will you continue with this? Thanks. So thank you for that comment. And yes, we are committed to continue to share updates with the community, and there will be future, information sessions, and we will be notifying you guys as well. So again, sign up, subscribe for those notifications so you know where. And again, we'll be also advertising it through our social media channels and website. All right. That takes us to the end of our questions. I just want to thank you to our panels. And I'm just going to pull up that email address here for you guys again while we switch screens here. Sorry, guys. And I thought I could do this quickly, but here we go. So there it is. Again, you can reach out to us with any concerns or questions, feedback, anything that you've heard from tonight. If you have any other questions, please do reach out to us, bhredevelopment@fraserhealth.ca. And on behalf of Fraser Health, the Burnaby Hospital Redevelopment Project team, thank you for joining us tonight. Thank you for all those great questions. And again, we do look forward to sharing with you guys again in the near future. Have a great evening, everyone.
Thank you so much. Well done, Wendy. Thank you. Bettina's there. Is she? Oh,